Good morning. Today is Friday, February 18th, and this is my third monitoring appointment for my current IVF cycle. Just got here to the clinic that I'm monitoring at locally in Orlando, and we're going to do another ultrasound and some more blood work to see how my follicles are growing. The last check-in, I had 7 total, but they were still really small, too small to count, so I'm hoping that they've had some more growth since Wednesday. I kind of expect that maybe Monday I'll see more of a difference at that appointment, but we'll see how this goes. We're trying to figure out when we need to go travel to Syracuse, New York, which is where our clinic actually is. So it's kind of a logistical nightmare with trying to figure all that out and determine maybe when I'll trigger and all that. And I'm just trying to have hope, you guys. You know, I have a little bit of PTSD, I think, from the last round of IVF. We were at a different clinic, but I still had like a very slow progression. But I think it was because of a medication I was on that was like preventing my growth. This time around, I'm not on that medication, which is great. So I just have to be patient. And that's really, really hard sometimes considering I've gone through this already. But trying to be positive, and you know, I just really would like for us to have at least, you know, 2 embryos of our own that we have to transfer. So we're going for quality over quantity this time. So I know that it takes my body a while to respond. It just, you know, I stim longer than other people do. So yeah, we'll see. I'll let you know how the appointment goes. Okay, so that was a good appointment. There's definitely some growth going on there. I don't know the sizes, but I was kind of like, I was looking as she was measuring things, and it looks like things are a little kind of all over the place. I did see one follicle that was 18 millimeters, so that's a little scary because I don't want that one to ovulate. But some were like 9 millimeters. It was like from 9 to 13, 9 to 12 to 13 to even 18 or 14. So the nurse will call me today and let me know where everything is, but I bet you they'll have me start my Cetrotide today. And that's a shot that helps to prevent ovulation, and it helps to kind of even things out. So yeah, I bet they'll have me start that today, but we'll see. But I just wanted to tell you guys, I had the nicest conversation with the ultrasound tech today. She was so nice. She was just like reassuring me that, you know, just focus on today. You know, she's like, a lot of patients on day 2 are worried about day 10, and I always try to encourage them to focus on today. And I just really needed to hear that, because I think in IVF you get so far ahead of yourself sometimes, and you know, it's nice to have someone that will just kind of like bring you back down to earth. And that just felt really good. She was very like compassionate about, you know, probably my emotions and my anxiety through all of this. So I really did appreciate that. That was really sweet of her. Thank you, girl, if you're watching. But yeah, so I'll update you when the nurse calls. All right. Okay, I'm ready.
All right, perfect. We have ultrasound and blood work, and everything is moving in the right direction.
Okay.
Now, did you start your Cetrotide this morning?
No, they told me, they didn't tell me to start this morning, so I haven't done that yet.
Do you have it with you to do it now?
Yes. Mm-hmm.
Okay, perfect. So start that now, and then tomorrow you will start doing it in the morning. So First do it now, and then in the morning, Saturday, Sunday, Monday, your gonal F and your menopause stays the same tonight, tomorrow, and Sunday.
Okay.
We'll continue on with all other medications, and then repeat your monitoring appointment on Monday.
Okay, and which dosage for the Cetrotide do I need to take?
Each box is 1 dose.
Okay.
0.25 milligrams.
Okay, got it. Okay.
Looking at, like, we've got 2 11s and a 12 on one side. We've got 11, 10, and a 16. So it's looking good.
Okay. And then do you guys have any idea of when I might trigger? Will we probably know better Monday, or?
We'll know better Monday. It's not going to be, you're not going to retrieve before Wednesday. So we're looking at most likely Thursday or Friday, I would think.
Thursday or Friday. Okay, got it.
Later in the week. Mm-hmm.
Okay.
Sound good?
Yeah, that sounds good. We were just trying to decide if we should probably just come up maybe Wednesday and just be there, you know, just in case. So, because we're coming from Florida, so we kind of, you know, have a long ways to come.
Right.
So even if we trigger there and have to monitor there one day, that's fine. I think we're just trying to determine when we need to buy flights, you know?
Right. Well, I would definitely, see what happens at your Monday appointment. Then we'll know pretty much for certain at that point.
Okay, that sounds great.
All right.
Okay.
All right, Sherry. I'll put your instructions in, and we'll talk to you on Monday.
Okay, talk to you then. Bye-bye.
Okay, bye-bye.
So it's looking like everything's progressing along nicely. I do have to start another medication right now called Cetrotide, so I'm going to go and do that. And then I have to take that every morning at the same time. So the Cetrotide kind of helps to even out the follicles. So I don't know if you heard the numbers that she read off. So my left ovary, I have 3 follicles, 12 millimeters, 11 millimeters, and another 11 millimeters. And then on the right side, I have 4, but only 3 are measurable. So 16 millimeters, which is kind of, getting on the bigger side, 11 millimeters, and then a 10. So hopefully the Cetrotide will kind of like even those out. And it also prevents me from ovulating too early. So I don't want to lose that 16 millimeter one. Because when they get to be about, I think they want them to be at least 14 or 15. They can go all the way to like 20 or so to be able to get a mature egg out of it. So, yeah, that's where we are right now. And then I go back on Monday for another appointment. So we should hopefully be able to buy our flights by Monday, I'm thinking. But it's looking like we probably will have an egg retrieval on Thursday or Friday. So that's kind of pushing it close with our trip. But we might just have to go a day late. That's fine. All right, so let's go do this Cetrotide shot right now. Cetrotide. So I've never done Cetrotide before. I've heard that some people have like a little bit of an allergic reaction afterwards. Praying that does not happen to me because I cannot stand itch. So let's try this. All right. So make sure you can see what's going on. All right. So Cetrotide has to be refrigerated. I love this box by My Vitro. You can put this right in your fridge. So I have like all my medications in here that have to stay refrigerated in here. So let's get the Cetrotide out. And these are like 1-dose boxes. So this is kind of how the box looks. And then there's just like 1 dose per box. So it's already pre-filled. That's easy to use. Back in the fridge. So we have our Cetrotide here. I'm gonna open this up. I don't know why, you guys, but I get nervous every time I have to take a new medicine, so it might be a little all over the place, but it's all good. Yeah, this is how it looks. And I need to watch a video real quick because I have no idea how to do this. So I'll be right back. I love the CVS specialty pharmacy videos. That's what I like to watch. I thought I was recording you guys when I gave myself the Cetrotide, but I wasn't. This is the aftermath. It's all gone. So it went well. I'll get tomorrow, but yeah, it didn't hurt. So we'll see. I hope I don't get like any itchiness like some people get, but it went well. So, all right, day 7 is good. Just the goodest boy. He's a good boy, Blue. You stay right by mommy. I'm gonna have to do my shots. There's Lena. Here comes Lena. Boop. 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 Good doggies. You're such a good girl, Lena. You too are a good girl. Always helping mommy. Good girl. Say hi, people. Say hi, it's me, Lena.
You have to be your biggest fan. And when things are really tough and they're really rough and nothing's working, but there's something inside of you that says, I just have to follow that. Because you don't know who you're going to be, who you're going to be, who you're going to be.
Hey guys, what's up? It is let me see what day is today. Day was Friday, so it's day 10 of stims. I don't feel that great today. I'm feeling just really bloated, like just kind of heavy. This kind of happens like, you know, as you get to the end of your cycle where your eggs, your follicles are getting bigger, you know, your body is only used to having like one big follicle at a time, not multiple, and I have 7. So yeah, I just started kind of feeling it yesterday when I went and got my hair braided. I was just like sitting up for a really long time. It took her probably like 5 or 6 hours to do my hair. Turned out cute, can you see? Got some knotless braids. Yeah, it just started yesterday. I started feeling like heavy and bloated and just kind of blah. It kind of feels like what you'd feel like on your period, you know, but maybe like a little bit worse in terms of the bloat. Not the cramping, but the bloat is just really uncomfortable. And then like, so your ovaries are kind of like enlarged right now, pretty much bigger than normal because of the follicles growing, and so it just like affects everything else. So like when I'm like, if I have to go to the bathroom, my bladder like makes it feel worse because like it's kind of probably like, because the ovaries are so enlarged, you know, like your bladder is probably like bumping into them or something. So it's just kind of uncomfortable. So everyone at this phase is kind of like, I just want to get these eggs out. So that's how I feel. Then I have a slight headache from combination of the Menopur that I'm on that always gives me a headache. And then these braids are a little tight. They're not really bad, but you know, fresh braids. I don't know why I chose to do this right now, but yes, I do know why I chose to do it, because things are just really busy right now with work and managing IVF, and it's hot as AF in Florida. And then we're also going to Mexico this week and coming up, so I just don't want to be bothered with my hair. But yeah, I'm not feeling that great. So it's about 11:07 right now. I'm gonna try to go to bed early because I also have a monitoring appointment in the morning. So hopefully we will know more tomorrow about when we'll have to travel, because right now everything's up in the air. So we kind of hope that we leave Tuesday. Today's Sunday. We hope that we get to leave Tuesday so that egg retrieval will be on Thursday, and then we can get back here in time, maybe Thursday night, and catch our flight Friday for Mexico. So that's wishful thinking, but fingers crossed. Yeah, I had a really productive day today, despite my discomfort. I got up pretty early, like 8 o'clock. so that I could start preparing for the week. I did my packing. Well, I laid all my clothes that I'm gonna pack for Mexico and for New York for egg retrieval, because we're gonna just pack for the whole week just in case we get stuck and have to like reroute from New York and can't come back to Florida. So we're gonna board the dogs on Tuesday, and then we're gonna pack for the week. So I laid all my clothes out, finished washing clothes over the weekend, did my toes. I did gel on my toes, gel polish, and then I did some work for my job so that I can kind of be ahead tomorrow, because tomorrow might technically be my last day in the office for the week. So I just prepared for that just in case. And then tomorrow I cleaned up as well. And then tomorrow, all I have to do is pack and do my nails. And I think that's it. So yeah, and then I realized today that my outfit for the wedding is not good, doesn't fit. Ugh. I don't know why I didn't try it on then, but whatever. I thought it would just be, I bought the outfit, it was too small, then I went back and got a bigger size, and I just thought it would fit. And I didn't try it on. Thank God I tried it on at least today. So I ordered a dress from ASOS. It should be here Tuesday. Fingers crossed. So yeah, I think I'm as ready as I can be. And I'm just hoping that I don't feel crummy, you know, because it makes it harder to do things when you don't feel good. So I will check in tomorrow after my monitoring appointment, and then also when the nurse calls me later in the day, and I hopefully should have some more information on when we're going to be traveling. So I hope you guys have a good night, and I'll talk to you tomorrow. Bye. Okay guys, I just got here to my monitoring appointment, and I have to give myself this Cetrotide shot. So I'm gonna get ready to do that now. I have to take it every morning, like about 8:30. So I brought it with me, and that's why I love this, my Vitro case, because you can literally put any kind of shots in here you need. Cetrotide comes already like in a pre-filled syringe, but sometimes like if I'm having to take a shot while I'm out, I'll like, you know, pre-mix it at home, as long as it doesn't need to be refrigerated. And I'll just like tuck it in here, and then you know, I'll be on my way. So yeah, I'm in the parking lot, and I got my little ice pack here, getting everything ready. So I think I'm almost ready to give myself the shot now. Oops. Pack just getting me ready. So I'm gonna go ahead and mix this. Do it down here. My stomach is starting to get bruised. It's really sore. But it's all good. Okay. All right, 1, 2, 3. I'm ready.
All right, so we have the ultrasound, but are still waiting for the blood work from CRM today.
Okay.
You've made good progress over the weekend, which is wonderful news.
Okay.
Excuse me. Today, you only have one follicle that meets criteria to trigger so far. It's at 20 millimeters on the right.
Okay.
But you have a whole group.
Yeah.
A 15, 3 at 14, a 13, a 12, a 10, and some smaller ones that we are recommending after much deliberation to continue your current doses and repeat ultrasound and blood work on Wednesday.
Okay.
We feel fairly confident. In fact, I've already booked a retrieval for Friday, which I'm not really supposed to do, pre-book, but I did. For you for a retrieval in Syracuse on Friday. but we will confirm your trigger instructions once we have Wednesday's ultrasound.
Okay, now,
So
do you think that we
what
should...
that means medication-wise.
Okay, sorry, go ahead.
It's all right. So what that means medication-wise is you need to stay on Gonal F-150 and Medipure 75 tonight and tomorrow night.
Okay.
You need to stay on your Cetrotide through and including Wednesday morning.
Okay.
If you have enough Omnitrope, you will also continue that through Wednesday.
Okay.
You'll take all of your medicines by mouth as usual, and then, like I said, ultrasound and blood work again on Wednesday.
Okay. Now here's my question for you.
Yep.
We're trying to determine when we need to travel. Are we able to just do monitoring there on
You
Wednesday?
sure can. If you wanted to come up and be here on Wednesday for monitoring, sure.
Okay. Just trying to think about that because...
Or you could wait and schedule travel to get here sometime on Thursday. We know we're not going to retrieve before Friday.
Okay.
So if you wanted to travel sometime on Thursday, still do monitoring locally on Wednesday, that's fine too.
Okay. Okay. Yeah, we are in the middle of double booking craziness. We're supposed to be in Mexico for a wedding this weekend, but we already know that we'll probably have to go late. That's fine.
Poor things.
Yeah, it's fine. This is way more important. So we were just trying to determine when we think. Now that one that's 20 millimeters, do we think... Unfortunately, my battery died while I was listening to the nurse giving me my instructions. So I made a voice note, so I'll let you guys listen to it. Is that what you guys have too? Oops, start over. I'm sorry. I'm just showing here that they have 3 on the right, and then 5 on the... I'm sorry, 5 on the left and 3 on the right. Is that what you guys have too?
So we've got on the right 1, 2, 3, 4, 5, and then a little one on the right. So 6 total on the right.
Okay.
And then 1, 2, 3, 4, 5 total on the left. 2 of the ones on the left are 8 millimeters.
Oh, okay. So they...
So above 10 millimeters, you've got 3 on the left.
Okay.
And the 5 on the right. So that might be what you're seeing different.
Okay. And then, if you don't mind, let me just confirm that I have enough Cetrotide, because I think I have...
Sure.
Let's see. Here. I usually go long on stims, like 14 days.
Yeah.
This is my first time with a mini IVF, and then I was on like Lupron every day the last time, so that's why I went long. It was just understressing me. So I only have 2 boxes of Cetrotide left.
And you took this morning, correct?
Correct.
You should be fine.
Okay.
It's up to you if you want it, because I do really think you're going to be ready to trigger Wednesday night. So that would mean your last Cetrotide is Wednesday morning.
Okay. Got it. Okay.
Yep.
Okay. Yeah, well, if you don't mind, I do need another order for monitoring at CRM, because today was the last appointment they booked.
Yeah.
Just in case. And then I'll keep you guys posted on when we come. We were just
If
worried
you
about...
decide,
We were worried about
if
weather.
you decide to travel before and come on into our office on Wednesday, just give us a call and we'll get that scheduled for you.
Okay, that sounds good. And then,
And you want me to fax this to CRM?
please, if you
Just
can.
put the, okay, yep,
Yeah.
I can.
You can. And is there any medication that I'll need for like pain that I need to get filled before I come?
No.
No? Okay.
Nope.
Got it. Okay, awesome. Well, thank you.
You're welcome,
Oh.
and I will update your portal with these instructions.
Last question. Usually what time are egg retrievals? Like, what's the latest that it would be?
Well, because I pre-booked you, your retrieval is at 8 a.m. on Friday,
Okay.
which means you would have to check in at our office at 7 a.m. on Friday.
Okay. Okay, tonight is the next night of stims. It is day 11, I think. see. Yeah, day 11. I think it's day 11. I thought that my last day of stims was going to be yesterday and that I would be maybe doing trigger tonight or something, but nope, we got to go a couple more days. So that's fine. I'm making really good progress, as I said before, so let's get these shots out the way and then I have to finish some more work. Okay, good morning. Welcome to another day. I'm headed to hopefully my very last monitoring appointment before we do trigger shot. Today is Wednesday, February 23rd, and I'm headed to the clinic now here in Orlando. And then we fly out to Syracuse tonight so that we can do our trigger shot there, and then we'll do egg retrieval on Friday. So fingers crossed that everything is looking good today and that the follicles are big enough to where they think they'll have mature eggs in them. Fingers crossed. So I'll update you when the nurse calls me today. I have to do my Cetrotide shot in some random room at the clinic, so here we go. All right, so I just got back in the car from my monitoring appointment this morning, and I think everything went okay. The sizes are all bigger, that's for sure. And I still see some little ones still trying to pop up and grow. So this protocol has worked really well for me. I am 42, you guys, and so I'm older, going through IVF, and as you get older, your egg reserve decreases. So they sometimes feel like taking a lower dosage of medications can help, because sometimes the higher doses have the opposite effect. Sometimes the higher doses, they kind of have the opposite effect and they can make no growth. So I was on 2 high dose protocols prior to this, and the first time that worked for me, but we just didn't get any normal embryos to, take home as a baby. But the second time, my growth just kind of slowed down. And so I didn't make it to IVF. I didn't make it to egg retrieval. So we had to do IUI. So this time I'm on a lower dose protocol and I'm only taking medications once a day in the evening. And it's about half of what I was taking before in terms of dosages. So it's called mini IVF. But that's worked really well for me. My body is responding great. I think I'll definitely trigger tonight. I hope so. I have to wait for my nurse to see what they say. But I'm hoping that I'll trigger tonight. Might have to do it in the airport, which sucks. Because we're leaving at 4 o'clock today, and I have to take the dogs and drop them off at boarding. So, yeah, we're excited. Everything has been going great. And please keep us in your prayers. But, yeah, that's the update for right now. I'll let you know what the nurse says when she gives me a call. So hopefully I'll hear from her soon before like 1:30. So fingers crossed. All right. Okay, I'm ready.
So, with that being said, no more gonal, no more manicure. You did your Cetrotide this morning?
Yes, I did. Mm-hmm.
Okay, no more Cetrotide.
Okay.
No more Omnitrope.
Okay.
Your LDN we're going to put on hold until after your retrieval.
Okay.
And everything else you'll continue. You'll continue your prednisone, your Benadryl, Claritin, Pepcid, prenatals. All that you'll continue.
Okay.
Tonight at 9 p.m. Eastern Standard Time, you're going to trigger with, do you have Lupron and HCG?
Yes, I have Avidrel and the Lupron.
Okay. How many Avidrel do you have?
Just one.
Okay. Let's see here. So you'll trigger with your Lupron.
Okay.
And the Avidrel.
Okay.
Okay. I'm just as I'm talking, I'm putting it in the
instructions. Okay.
Okay.
At 9 o'clock tonight.
Okay.
Okay. Nothing to eat or drink after midnight tomorrow night.
Okay.
Arrive in the Syracuse office Friday at 7 a.m.
Okay.
And you're scheduled for an 8 a.m. egg retrieval.
Okay. Perfect.
Okay.
Question about the triggers. Now, are they? So the Avidrel is like a pre-filled syringe. Is that in my stomach or in my butt? Okay.
Yeah.
Got it.
Both of these will go in your stomach.
Okay.
Now your Lupron, is that in a pre-filled syringe or is that in a vial?
It's in a vial.
Okay. So basically, you're going to drop, if you have an insulin syringe that goes up to 100 units, you're going to drop to 80 units on an insulin syringe.
Okay.
Or if you don't have one of those and you have a 3cc syringe, you're going to drop to 0.8 on the 3cc syringe. So what I'm going to do is when I upload your instructions for all the meds that I just talked about, I'm going to do one for Lupron also, which states those two doses. So what I want to do tonight, I'm not sure when you get into Syracuse or anything.
Yeah.
But
we might have to do
sometime before 9 p.m. Get it into a syringe.
Okay.
So that at 9 p.m. all you have to worry about is just poking your belly.
Okay. Got it.
Okay.
Okay.
So if you have any questions, you can call the on-call nurse. But usually the instructions are really good, and I think there's also injection lessons on our website.
Okay. Yeah. That's good. That's completely fine. I have a couple of questions for you about egg retrieval. Now, are they doing assisted hatching with the embryos? Is that?
If that's what you want.
Yes. We do.
Okay.
Yeah.
I'll make sure that usually they do, unless you specify on your consent that you don't.
Oh, okay. Yeah, we definitely do.
I'll make sure. What do we have for sperm?
So my husband, he'll be giving a fresh sample. So does he need to come any earlier than 7, or is 7 still fine? Okay.
Yeah, 7's fine.
Okay.
7's fine. And you have 4 donor eggs. Are we thawing all 4?
Yes.
Are we not doing any of them? Okay, all of them?
Yes, all of them.
Okay, perfect. And then, are you doing PDD testing? No, right?
No, we're not. No, I think we're going to do, now with the donor eggs, I know Dr. Kiltz recommended a day 3 freeze. So are we going to do that with the donor eggs also, or is it different?
That's a great question, because I did see anatomy 3. I'm just looking at it now, because it does say usually they do. I'll check and see what provider's on Friday too.
Okay. Yeah, I had requested Dr.
What they'll do is they also call you the next day and let you know what their recommendations. If they're really progressing nicely, they're saying we should really push it to 5, or if we freeze them all at day 3.
Okay, got it.
Transfer. Are you doing a fresh transfer, or are you freezing all?
We're freezing all. We're gonna freeze.
And your COVID status?
So we just went and had our test yesterday. So we haven't gotten the results back, but our vaccine records are both uploaded to the portal.
If you guys have been vaccinated, you didn't have to get tested.
Oh, okay. Got it. We just did it just in case.
Sorry.
It's okay.
Okay. So I'm going to upload instructions to your portal. It's going to be where you get your lab slips. You're going to see IVF instruction sheet, and I'm going to have a Lupron instruction sheet. The Avidrel is pretty self-explanatory because it's already in a pre-filled syringe. So.
Okay. And does that need to stay cold while we're flying and stuff?
Yeah.
Yeah. Okay. I'll just put an ice pack in my.
Do you have a letter to fly with needles by chance?
No, I don't. If you could give that to me, that would be great.
I'll upload one right now for you.
Awesome. Okay. I was wondering how that worked.
Yeah, usually we upload a letter that says you can fly with needles, and then I'll put Avidrel's name and the Lupron name on there too, so that they don't question anything. And they never have, but knock on wood, you know what I mean?
Right.
I'd be that lucky person that they'd stop.
Right, exactly. Okay, and then am I scheduled with Dr. Kiltz for my egg retrieval?
Oh, I was going to look to see, who's on the schedule. Hold on
Okay.
a second. I'll look and see who is. Your letter's in your portal.
Okay, thank you.
And let me look at the schedule. Last I knew, Dr. Kiltz was in Sarasota.
Oh, okay. He's in Sarasota, or?
He may be. It was last week, so who knows?
Okay.
Let me just check here. Friday schedule. Oh, they're both scheduled for. He's in. I think. Friday, Dr. Kiltz is doing surgery at Krause.
Okay.
It'll be Dr. Corley.
It'll be Dr. Corley.
Okay. Yep.
Okay, cool.
If Dr. Kiltz is there, just request it and he'll do it. He has no problem with that. I mean, if he's there. If for some reason he pops over or a surgery, it looks like it's for surgery first thing in the morning. So.
Okay.
Krause isn't far from our office, so he pops in and out sometimes.
Oh, okay. So I'll be coming to the office, right? Not Krause. I'll be coming to
Correct.
Okay.
Yes. No, you'll be coming to the office. Sorry about that.
Oh,
no,
okay.
his surgery's at Krause Hospital.
Okay. Got it.
Your procedure's at the office. Yes.
Okay. Perfect.
Okay.
Okay. Thank you, Shannon. I'm really excited. Oh, did they tell you the numbers, the counts for the follicles?
Let me take a peek here. They gave me numbers. I'm kind of questioning whether their numbers are correct or not. But
Yeah.
let's see. Oops. That's not you. Jerry. There you are. Oh, that's your donor egg flow sheet. I think the other flow sheet. Sorry. I think I saw possibly 4.
That were.
Not that you're not going to have more. One, a 22, a 23, 2 at 18. You have that 15, which could easily be mature. And then the next one's a 2 at 14 and a 13.
Okay. So those might catch up. So what size do they need to be, like, for a mature egg?
They like them to be between 16 and 22.
Okay.
So,
Okay.
the older we get, the earlier they like to trigger.
Right.
So.
Right. Okay. Okay. So
But you still have, yours range from 14 to 23. So no matter what, you're going to get some.
Okay. Okay. And then how many total follicles did they count today? Do you?
1, 2, 3, 4, 5, 6,
7.
7.
Oh, okay. I thought
7,
I had.
and then it still was like 7 under 10 millimeters.
Oh, okay. So 14
So.
total?
Yep.
Oh, wow. Okay.
Yep. 7 are really tiny. Yeah.
Okay. Got it.
But when they go and do the egg retrieval, they collect any bit of fluid that's in your ovaries. Because there may be one hiding. You know what I mean?
Right.
So much on ultrasound machine because it's not really 3D.
Right.
So, and your estrogen level is 624, which is fantastic. Having taken even letrozole.
Okay. Perfect.
So, everything looks great.
Okay, yeah, I'm really happy with this protocol. This mini one has really worked well for me. The first time I did this, I got 11 eggs, and 2 were mature. So to have like 14 even growing is great,
Right.
So that's
it's fantastic.
great.
Yeah. Wonderful. Yay.
Awesome. Well, thank you so much, Shannon.
All right. Well, you have a safe trip.
Okay, we'll do. Take care. Thanks.
Okay. You too.
Bye-bye. Uncle John. So I didn't catch. Oh yeah, I did catch it on video, but I have to give myself this trigger shot at 9 o'clock on the dot. So what time is it? We got 17 minutes. I'm about to load up the needles, and then you can see we're here in the Delta Lounge. So we got to do it in here. We found this little nook. So I'm about to like put my coat on my suitcase to make a little barrier so nobody can see. But this time the trigger shot goes in my stomach, which is good, not my butt. because that would suck. So we're about to get this party started. I had to give myself that Cetrotide shot today with no numbing first. Bruh.
Oh, because you didn't bring a little pad?
No, because I almost forgot it when I was leaving the house today. And I ran back in to get it. And I definitely did not have my ice pack with me. I'm going to do the Lupron first. So I'm taking 2 trigger shots. Taking Lupron and Avidro. So the Lupron comes like this. And the Avidrol is in a syringe that's already loaded right now, so giving me extra life. So for this, I'm gonna have to use 2 needles. It has to be 80 ml.
Stuff ready?
What a waste.
You don't use the whole thing?
I don't think so. I don't think it's gonna be all of it. So we got 1. We got 2 of these. One is like the whole syringe and one is just 30. So that's Lupron. And then the Avidrol I'm gonna take out later. It has to stay refrigerated. So I think right now I'm gonna just ice my belly. Try to ice myself a little bit. You want to do it? Or not?
It's sticky?
No. You don't? Why? Are you scared?
You can do it. It's different when it's in your stomach because you can actually feel that.
No, it's better in there than in the other one.
You do it. Unless you want me to do it, I'll do it.
No, I'll do it. It's just like what I regularly do anyway. Ready?
9 o'clock on the dot.
1, 2, 3, 4, 5. Shot number 1. Number 2. A little blood. Going in. 1, 2, 3, 4, 5. This is the last one. done.
Alright, girl.
All done.
3 shots like a champ.
I don't ever want to see another shot after this. Well, I have another set we're gonna have to do. Never mind. All done. We did it! We did it! Now we gotta clean up all the needles and the drugs.
Don't record that part because you gotta dispose of them properly.
We gotta dispose of these properly. In a Starbucks cup. Okay, well, our flight leaves Detroit. We had a layover in Detroit. We're gonna leave here at like 10:54
Yep.
and head to Syracuse next,
Next stop, Syracuse.
where it all goes down. So we'll check in when we get to Syracuse. We made it to Syracuse and now we're in our hotel room. Anybody's coming here for fertility treatment at CNY. So far we are staying at the Craftsman Inn Hotel and it's cute. It'll do for 18 hours. So yeah, here's our room. Small and quaint. It's got the basics, king size bed. It's very like farmhouse chic, modern farmhouse style here. Nice TV. And they have free breakfast downstairs, so I'm all about the free breakfast. So yeah, this is our little room for the next 2 days. So tomorrow we don't have anything going on. We just wanted to get here early so that we could avoid any like delays in travel or flight cancellations, anything like that. So we have tomorrow off to just relax. So plan to just sleep in the morning and just chill. It's been a really busy work week for both of us. So we're gonna just enjoy ourselves, take it slow, eat some food, and relax. 8 a.m. will be the time for egg retrieval on Friday. So we have to be there by 7. And then I can't eat anything after midnight. So yeah, that's the plan. Tasha's in the bathroom. But yeah, it's really cute in here. I think this is, pretty cool. And then they also have a CNY special rate. So if you're going to get treatment at CNY, when you book, just mention that you're a patient there and the room rate is like $79 a night. Not bad. All right, well, we will check in tomorrow and let you know how everything's going. So I forgot to show you guys the bathroom here last night. Just kind of starting the day, and it's really cute. It's small and quaint, but I love this mirror with the lights around it. I might have to do something similar at home, but yeah, I just wanted to show you the bathroom. So we are about to get ready for the day and go find some lunch because I cannot eat past midnight, so I want to eat a good lunch and a good dinner a little bit later tonight, maybe like 8:30 or 9, Tawashi was saying. Because when we get up, I will have no food and can't eat until after the egg retrieval. So don't want to be hungry, but I just wanted to show you the bathroom. It's really cute, right? Okay, we'll check back in later. Okay, so we're out, freezing cold. Look at this one. It's cold. Got his whole Adidas field coat on. It's freezing cold.
Flipping cold.
We're trying to go over to Target to see if we can find a heating pad for me for tomorrow, and then we're gonna grab some lunch, and that's about it. Not a lot going on, but we'll see what we find at Target. We got the heating pad. Good old Target to the right. Now we find food. So we are back in our hotel room. We just went and grabbed some lunch really quick, and then I had to get a heating pad for the plane ride home tomorrow in case I'm a little bit sore. But just wanted to come in and check in and tell you what the plan is for tomorrow. So we have to get up really early, have to be there by 7. Talashi will have to give his fresh sample there. And my egg retrieval is scheduled for 8 a.m. And then I did call the nurse to see what the protocol after egg retrieval is, because we're leaving and we're going to Mexico. And usually they'll give you an update on, you know, how many eggs that they got and the fertilization report. So they said that tomorrow's Friday is my egg retrieval. I think they might tell me there, like, how many eggs they actually got. But I won't really expect it probably until Saturday when they give us the fertilization report. So we'll hear from them on how many of the eggs were fertilized. And then I think we're gonna freeze on day 3. So my doctor recommended that we freeze on day 3, just because with me being older, he was saying that usually, like, older women, you know, the embryos do better in the body growing rather in the lab. So we're gonna freeze on day 3, and then that will be on Monday. So we should probably get another report on Monday, and then we'll go from there. So we're planning to transfer, fingers crossed, in March if possible. So I'll have to wait for another period to come, and then I'll go in for baseline appointments and more monitoring, and then I'll start taking this dreaded shot in my butt every day until I'm 10 weeks pregnant. So that will prepare my lining. So we're planning to do that in March sometime. I don't know the timeline of that yet, but it will all be focused around my period. And then hopefully I'll be pregnant within 2 weeks of that. So it's really exciting to think about the possibility of potentially being pregnant in a month, you know? Just after our last IVF cycle, we didn't get to egg retrieval. So that was, like, kind of disappointing. And then we've had kind of a break between that. So to kind of have made it this far, at least to egg retrieval, I'm really thankful for that. So still gotta take it one day at a time, but that's the plan. Of course, we will vlog in the morning and try to get some shots there. I'm really excited to be at CNY. I've been, like, stalking them on Instagram and Facebook. I'm in so many of the CNY groups. So to actually be here in Syracuse and, you know, potentially meet the doctors that I've been working with all this time is really, really rewarding. It feels really good. We've both had really good vibes this time around, and everything has just felt like way more positive, and protocol has been awesome. So yeah, I hope I get to meet Dr. Kiltz. That would be great, even if it's just to take a picture with him. Don't think he's going to be doing my egg retrieval, but they said Dr. Corley is on schedule to do my egg retrieval, and he's amazing too. So yeah, hopefully we get to meet some of the great doctors and other staff there at CNY, and we'll keep you posted. All right, I'm gonna enjoy this chai latte. It's below 0. It's like, it's not that cold here, but compared to Florida, it's freezing to us. So we're gonna enjoy our warm chais and just do nothing. Probably gonna watch some YouTube. Okay, check in later. Good morning, welcome to another day. Today is egg retrieval day. Right now it is 6:14 and we've been up since about, I guess, 6 o'clock, getting ready to head over to the Syracuse office of CNY for my egg retrieval this morning. There's a lot of snow on the ground. There was like a winter storm last night. It's probably like maybe 3-4 inches of snow on the ground, so hoping that doesn't delay anything. But yeah, we're just getting dressed. Talashi's in the bathroom and I just got out the bathroom. They said I can't have any like strong fragrances on, so I didn't put on any lotion, just on my face, because I have to have a little on my face. And yeah, I hate that because my body, like, I always have to put on lotion after the shower because my skin gets a little itchy. So yeah, we are just getting ready. We're gonna head there and Talashi will have to give his sample, and they'll prep me for egg retrieval. So fingers crossed. I hope we have some really good results, and I hope we get to meet Dr. Kiltz today and Dr. Corley as well. So yeah, say a prayer for us, and I will let you guys know how everything goes. All right, bye. Look at this, you guys. Just trying to focus. The snow trucks. This snow. At least the trucks are out. Wow, it's a lot. You ready? You excited? You look so excited.
No, actually I am.
He's tired. It's really early.
This is a culmination of all the hard work that you've done.
And research.
So I'm excited to get to this day.
Me too. Me too, babe. We're here! Finally made it. Yay! We're here at CNY. So excited.
Let's go.
Take my picture.
Yeah, I'm on my phone.
Look at Dr. Kill. We're here. So beautiful so far. It's like a living room there. There's no foodie for Dr. Kill. Yeah. We're ready. So we are in our waiting room. They have us in a private room here. It's a little dark with the lighting, so sorry about that. Let me go this way. But it's just a small little holding area, which is really nice instead of having to just wait in the waiting room. It's very spa-like in here. Spa music, everything. So, yeah, we're just waiting. And we'll go from here. I don't know if we can record, but maybe you can use your phone if you're able to sit with me in there. I don't want to pull out this camera, but yeah, it's super nice here. I wish I could like show you more, but I didn't want to like disturb anybody or interrupt anyone's peace, because there's a a good amount of people here this morning, so everyone's kind of like tense and a little nervous, so I don't want to pull out this camera. But yeah, we're in a private room. It's super cute husband. I made it. We got 12 eggs.
12 eggs.
That was one more than our first time, so I'm really happy about that. We'll get a report tomorrow to see how everything fertilized. Yeah, I'm happy, not in too much pain. Got our little heating packs ready, and we're gonna head to Mexico, but I'm really happy. The office was beautiful. I got to have Dr. Corley, which I was really happy to meet him finally, and everything went well. So pray for us, keep your fingers crossed. Now we are about to catch our Uber and head back to our hotel so we can like rest and get our stuff together and then get on a flight. So thank you, CNY.
Thank you.
All right, we are back from egg retrieval. Sorry I couldn't take much footage in there. Like I said, I didn't want to disrupt the piece like that. But the process was like really pretty smooth sailing. It was pretty in and out. The office is beautiful, so if you are a CNY patient and you plan to go to the Syracuse office, you will be very pleasantly surprised. It's very spa-like. There's like spa music and everything is kind of like, you know, ambient lighting and dark and moody and all that. Didn't get to meet Dr. Kiltz, he was in surgery, but I did have Dr. Corley for my egg retrieval, which I was really happy about. Very nice man, you know, just very encouraging and positive. And so we got results so far of how many eggs they retrieved. And we got 12 eggs, which is great. Woo! We're really excited about that. The very first time I did IVF, we got 11. So one more than the last time. And we'll get a report from them tomorrow to tell us how many of those eggs fertilized. And then we'll, you know, get updates on our embryos. They'll give us pictures in the portal and everything. So that's good. But yeah, I had a great experience. We are getting ready now to leave to head to Mexico for our friend's wedding. I wore my Lucky Pineapple t-shirt. I think I packed it like subconsciously, but I think that's a good sign. So pineapples for infertility and good luck. But yeah, that's the update for now, and I will let you know what they say when we get our first report. All right.